Limitation of Ayurveda. There have been many questions to me by students whom I train regularly, young doctors, even senior doctors, and all the health seekers who have come to us from 104 nations. Where do we see our limitations? Obviously, yes, every system has its own strength and the opposite. And Ayurveda cannot be an exception to it. It's a great system, no doubt. The reason I would like to speak on this topic is continuing from the last clip where I had mentioned about the responsibilities of an Ayurvedic doctor towards a health seeker, or what to expect from an Ayurvedic doctor for your experience of Ayurveda. I did stop at the point of the responsibility of the Ayurvedic physician in altering your food and lifestyle aspects if it is needed. Then goes to the next step, that an Ayurvedic doctor should be open enough to accept the fact that there are fantastic healing systems, be it the conventional medicine, you call it modern medicine, be it the TCM, the Chinese medicine, or the homeopathic system. The list is long, acupuncture, whatsoever you may call. The reason is very simple. If I put a very simple case to you, low backache, very common, sciatica, where you have the pain going from your back of the leg, or from the buttocks level or back till the feet or the tip of the toes, whichever, the pain radiating. So in these conditions, which are so very common in the Indian system or Indian society, we have realized that every system has a role. If somebody has a spinal canal diameter that is less than 9 millimeter, I would seriously wonder how much can an Ayurvedic doctor contribute to the overall healing. And of course, we all know that spinal surgeries apparently do not have more than 47% success. So when that reality is there, it is very much optimal for that person to go for Ayurvedic therapies, which has fantastic success if the spinal canal diameter is more than 9 mm. Of course, there will be exceptions in prognosis. In similar fashion, once the Ayurvedic part is over, physiotherapy assumes a lot of importance, very much. And follow-up exercises to tone up the musculature has a lot of significance, which cannot be denied either. At the same time, it is also very important the person is able to alter his ergonomics, be it his office, be it his home, wherever it is. There's a multiple pronged approach in multiple manners. And I would not hesitate to say that there are situations where I have seen I do use acupuncture when and when required, if and when required, in severe painful conditions. I've seen the relief in the patients a matter of easily 3 minutes. And I would challenge any Ayurvedic doctor to bring that same amount of impact in any patient without using acupuncture. So it's all about giving the best to the world, to every patient who comes to a doctor, that every system has its merit, its greatness, and its limitations. And this is very important.